All right, let's continue our discussion on acute diarrhea. Now we're going to focus on viral causes of bacteria. The first virus that we're going to focus on is rotavirus. Rotavirus is a member of the Rheovirus group of bacteria. This is a virus that has double-stranded RNA genome, which is kind of unusual. Typically, we're going to see double-stranded DNA and single-stranded RNA. Well, this virus contains this genetic information in double-stranded RNA that has an inner and outer capsid, and this viron is going to have a shape that resembles a spoked wheel. Because it has both an inner and outer capsid, this virus is particularly stable. The primary cause of morbidity and mortality from diarrhea is going to be this virus. Most people that die from diarrhea die from the rotavirus. If we look in the United States, approximately 1 million people every year are infected with rotavirus that initiates diarrhea, and of those 1 million people, 70,000 of them are going to be hospitalized. We have very seasonal occurrences of this. So in the southwest, it's going to be in the fall. In the northeast, we have outbreaks typically in the springtime of rotavirus. Rotavirus, like many pathogens that can initiate acute diarrhea, are going to have a fecal-oral route of transmission and be transmitted via contaminated food, water, or fomites. We're going to find that it's very prevalent in areas of the world that have very poor sanitation. In the United States, thankfully, we have fairly good sanitation, so it's not as common as other developing countries, but it still is relatively common with the United States. The course is going to be fairly mild, though, when infected in the United States compared to other parts of the world. The signs and symptoms associated with rotavirus are going to vary with age, the nutritional state of the patient, and the overall health and well-being of the patient. Babies, generally speaking, that are between 6 and 24 months old, lacking maternal antibodies, have the greatest risk of the fatal disease. So babies that have just stopped breastfeeding are at high risk of contracting this disease. Like most of our pathogens that cause acute diarrhea, we're going to have diarrhea, fever, vomiting, dehydration associated with the infection. Some things that are more unique to rotavirus is that shock is common. We'll have intestinal mucosa damage that can compromise the nutrition of the patient. And if we have repeated infections, those long-term or repeated infections can cause long-term malnutrition that can then retard the growth of the patient. If it occurs in adults, this infection, generally speaking, is fairly mild and will be self-limiting in that the adult will typically pass the virus through diarrhea relatively quickly before the virus is capable of establishing a long-term infection and being transmitted to other people. Children that are and contract this disease are going to be treated with oral replacement therapy, so they'll have fluids and electrolytes being consumed through a beverage. The oral live virus vaccine has been available since 2006. And since we've started using that vaccine, hospital visits due to rotavirus have been on the decline. Approximately 90% decline since 2006. So within a little bit less than a decade, we've effectively eliminated the vast majority of hospital visits due to rotavirus. Our next virus is the Norovirus. It's the second most cause of hospitalizations of foodborne illness in the United States. Norovirus is quite common. The fecal-oral route via contaminated food and water is the preferred method of transmission or mode of transmission for this virus. Is typically going to be associated with food, with employees at restaurants not washing their hands after going to the bathroom and then spreading the virus to the food that's being prepared. The symptoms of this virus are similar to the other pathogens we've discussed with acute diarrhea. There's going to be watery diarrhea for 3 to 5 days. Vomiting and fever can sometimes accompany it. Norovirus, though, is going to be a self-limiting virus that will work through our system relatively quickly. Treatment is typically going to focus on rehydration therapy with both oral solutions of electrolytes and glucose. The two causes of acute diarrhea that we focused on in this little mini presentation were the rotavirus and the norovirus. We did not focus on cryptosporidium. I eliminated that one for the sake of time. So we already have enough with our intestinal tract to talk about. If you have any questions for me about viral causes of acute diarrhea, please feel free to post them in the discussion board or shoot me an email. Happy studies!